First being is going to focus on the vaccination rollout program. Dr. Ansher and her staff in the health district, and supported by county and city staff, have been really scaling this up to a great extent. I'm going to let Dr. Ansher lead you through that, and then that's going to be followed by an update on our CARES Act funding and some of the other funding we received, and that'll be by Michelle Attree, Director of Finance. Dr. Ansher.
Okay. Chairman Wheeler and members of the board, I'm Dr. Allison Ansher. I'm the Health Director for the Prince William Health District. I'm going to talk a little bit about where we are with our vaccine rollout for the community. It's been a huge undertaking.
Madam Chair, can we have her move,
Supervisor Candler?
we have her move the microphones down a little bit?
We're having a little bit of trouble hearing.
Sorry,
Maybe can
thank
we
you.
actually, or, yeah, either that, and also low. The podium is really high, just saying.
Thank you, Madam Chair.
It's fine. We're fine.
Okay.
Thank you. Should I just go forward? Okay. Obviously, an event like this takes a lot of pre-planning. We started planning before the vaccines were delivered. We started by recruiting and training volunteers. The Medical Reserve Corps has just been golden. They have made it possible for us to be able to, thank you. Make me feel short. Vaccinate as many people as we have been able to. So they've been just terrific. Planning and hiring contract employees, ordering. Ordering and ancillary supplies for both the point of dispensing site as well as for vaccination, training on new federal scheduling and data entry systems, and developing and instituting vaccine-specific training. Prince William County Emergency Management has been a significant support. When we were supposed to get our freezer in, when we thought we were getting first Pfizer vaccine and requiring an ultra cold freezer, which still hasn't come in, the county stepped up and was able to find freezers that we could use for storage. Instead, we received the Moderna vaccine, which does not require ultra cold, but is kept in a normal freezer or can be refrigerated for a certain amount of time. Additionally, for our points of dispensing sites, they provided Wi-Fi hotspots, equipment and storage movement, locating facilities so that we can have larger points of dispensing clinics, developing and scheduling a system for those without email access. We're working on presently the scheduling system that we were given by the federal government to use requires email access. What happens is the person is notified by email to set up their appointment after they sign up using the their email address. So that's been a little challenge for us, particularly when a family uses one email, and so only one person can sign up for an appointment. So it's been a bit of a challenge. And also providing support at our call center. Some of the contractors we have hired, as you're aware, our environmental health specialists are required to provide oversight of complaints regarding businesses that are not following COVID-19 rules put out by the governor. Also hiring for our vaccination, administrative planning, and logistics supports, working on state contracts for additional vaccinators, and we're working with student nurses that are about to graduate with their preceptor to help with the vaccination efforts. Okay, as you all may be aware, the long-term care facilities, the assisted living facilities, and group homes that opted in are under a federal program to actually have CVS or Walgreens go into their site initially 3 times to vaccinate all the residents and employees that want to be vaccinated. So we wanted to make sure that all our assisted living and residential long-term care facilities and residential group homes were aware of the value of this service and signed up. I'm happy to say all our assisted living and long-term care facilities did take advantage of this. In addition, if many of them already have some agreements for flu vaccines with these pharmacies, so if they need testing beyond the 3 visits, they will continue it with the contracts that they already have. I'm happy to say about close to 90% of residents at Birmingham Green have signed up to be vaccinated. And I'm uncertain of the number of employees, but it tends to be less than residents. In addition, I was on a town hall meeting with the residents and their families of the Birmingham Green and their assisted living. We explained about the vaccine. We not encouraging them, but answering questions, the benefits, the risks, et cetera. And additionally, we had a town hall meeting for their staff to ask questions about the vaccine. We've also, as I mentioned, engaged group homes and encouraged them to opt in to have CVS or Walgreens come in and vaccinate their residents. Most folks are aware that there's limited vaccine. The state of Virginia right now is getting about 110,000 doses a week for the entire state. So some priorities were set up to vaccinate initially the most vulnerable and eventually the entire country. These recommendations were based on CDC guidance, but the state of Virginia has a group of over 100 experts. Some are medical of all ages, ethics, et cetera, that determined whether or not they were going to accept these recommendations because, as we know, each state, each community is unique. And this is what was decided. In the first group, when very limited vaccine was available, phase 1A, still is healthcare workers and long-term care facility workers and residents. And I had already talked about the long-term care facilities and residents using CVS and Walgreens. The hospitals received Pfizer vaccine to initially begin vaccinating their employees that had the greatest risk of being infected with COVID, the folks that were actually working with COVID patients, and then it expanded now to their employees in general. We were tasked, and you'll, as we move forward, you'll see what a large task that is, with unaffiliated healthcare personnel. Healthcare personnel is not just doctor, nurse, what have you. It's any individual who has potential face-to-face contact, therefore puts them at risk for COVID-19, but additionally, It also includes people who may be working in the food service or people who may be cleaning. So there is a piece of equity that was put into the thought of including all the personnel, not just what we typically consider healthcare workers. You may have heard that over this weekend, 11 jurisdictions in Virginia moved into Phase 1B, so we're continuing to vaccinate 1A, but have moved into Phase 1B. We're required, which may change, to go in the order that's listed from 1 to 9. Finishing one before we do the others. As part of our healthcare workers category, we chose to vaccinate the 3 jurisdictions EMS because we felt that they had the greatest risk of exposure to people who may have COVID. Initially, we thought perhaps their occupational health unit with Inova was going to vaccinate them, but when we found out that wasn't going to be true, we set up in CPAT and spent several days vaccinating all our EMS. We were delayed because initially we expected the limited amount of vaccine, which was a little over 1,000 doses, to come in on the 21st of December. It did not come in till the evening of the 23rd. Because of the potential for malaise, muscle aches, and whatnot, folks weren't real happy about scheduling appointments and being sick on Christmas. So we delayed beginning vaccination until the 28th of December. 28th of December, we began vaccinating our emergency management EMS partners through that week and through the part of the next week. Because we had already done fire and hazmat workers, for us, presently, Monday, we started with the police. It's not just our jurisdiction's police. We also had folks from the FBI that are downtown working on what's post the riot downtown, working as police, investigating and whatnot, that reached out to us. And so if they were from our community, we helped them schedule appointments so they could be vaccinated. As far as corrections, we are going to do the vaccination of both corrections and homeless shelter workers. But after a meeting with the adult detention center, they felt more comfortable vaccinating their inmates themselves. So we've worked with them to get them set up to have vaccine delivered to the jail. They're in the process of finishing up that. Their nursing staff, or their medical staff had to go through specific training. And so they will, in the not too distant future, through us, order vaccine and be able to vaccinate their own, the inmates there. They smartly are going to start with the inmates that are there the longest because it makes sense. A lot of their residents are in and out quickly and may not go back for the second dose. So it appears to start there would have the biggest benefit. We next, as far as childcare, pre-K, 12 teachers and staff, we were lucky enough, arranged for those folks to go through Inova Fairfax's large point of dispensing site. They'll be able, their information for them to sign up will occur on the 28th of January, and they'll start vaccinating them on the 30th of January through February 3rd. Those appointments are going to be specific for our region, our jurisdictions, schools, and then, of course, they'll continue to vaccinate as needed. Now, of course, that's not just public schools. We are reaching out to private schools to make sure that they also have the ability to schedule appointments as they wish. Childcare, because our environmental health specialists go in and inspect the kitchen of licensed childcare places. We're gathering information, and we will also provide them the information to be able to be vaccinated through Inova Fairfax Hospital. So that's sort of where we're at right now. Because we realize the health district can't do this by themselves, moving forward, you can see how tremendous the effort is. We essentially were responsible for about 18,000 unaffiliated healthcare practices. Those that are unaffiliated with the hospitals. So Inova, after they finished, did help us with some of our unaffiliated healthcare practices and continues to do so. We've also have enlisted Safeway pharmacies to help with vaccination. Now, they're not going to start with vaccinating that group, but they will be coming on board next week. They've chosen to do a points of dispensing site so that they can vaccinate more individuals as opposed to in a store. We have to remember the challenge with this, unlike the flu vaccine, people have to social distance, so you have to have room to have both your workers inside the point of dispensing site as well as the clients have the ability to be 6 feet apart, as well as because this is a new vaccine and there is some history, very, very few people, but there is some history of some people developing an anaphylactic reaction requiring epinephrine and being transported to the hospital. With people with certain health conditions or experiences have to stay 30 minutes post-vaccine to be observed, and other people 15 minutes. But remember that, again, they have to maintain a 6-foot distance between those folks. So you really need a large area to adequately be able to vaccinate folks. Kaiser in Woodbridge has partnered with us. We were able to send them some unaffiliated healthcare partners, and they're also vaccinating our dialysis centers employees. They've been really Johnny on the spot. If they have extra appointments available, they contact me and I'm able to send them folks to vaccinate. Our Greater Prince William for Federally Qualified Community Health Center, we've brought them on board to do, obviously, because of the clients they serve. Additionally, they have the ability to take a mobile unit as we move down to places that might need that mobile unit to help vaccinate. We've brought on the Mason and Partners Clinic because, again, the population they tend to care for. And so right now, the Community Health Center, Kaiser, Federally Qualified Community Health Center, MAP Clinic, and this Safeway Pharmacy, which will be with us 3 days a week on the East End in a points of dispensing site, will focus on the 75 and over community. And we talked about the long-term care facilities.
Dr. Ansher, at this point, I'm going to ask that you keep it more high level and move along more quickly, because I know that the board as a whole has a lot of questions
sorry.
and concerns. And
Sure.
so I know this is actually the most important thing that we're doing today, so I don't want to shut you down. But
No.
if you can keep to the information on the slide and then just get through them, and then we can have a discussion. Thank you.
So far our efforts, as I mentioned, the EMS has 3 jurisdictions, the unaffiliated healthcare personnel going on. Obviously, we vaccinated our pod site workers, last Saturday, we vaccinated all school nurses, both private and public, that wanted the vaccine, and as I mentioned, the dialysis center employees. This is the process that CVS and Walgreens are using on the long-term care facilities and assisted living. They go in and do the first dose, Clinic 1, Clinic 2, depending on the vaccine they have. Pfizer is 21 days later for the second dose. Moderna is 28 days. They'll come back and do the second dose and start anybody who missed the first dose and come back a third time to do the second dose on those that received the first dose in Clinic 2, and start anybody who needs to be started. And as I mentioned, they're open to continuing supporting that effort. We talked about that. The next after 1B is 1C, which is also essential workers. Here's a list of, and again, we have to go in order, but that includes the people 65 years and older and those from 16 to 64, because Pfizer can be used in 16-year-olds. Moderna 18-year-olds will qualify for this phase. Okay, and finally, phase 2 is the entire population. And we'll continue to try and bring on other providers. We know how people prefer to go to their own healthcare provider, so hopefully by that time, any healthcare provider will be able to offer COVID-19 vaccines to their patients.
Great. Thank you very much. I know that the board has some questions. I have one myself. If I could, I'm just going to, if you don't mind me jumping in and just starting off. I know we talked about our teachers waiting until the 28th and being with the, what I would call the excess capacity at Inova. I just want to voice my concern publicly because our teachers are actually in the classroom as opposed to Fairfax and Loudoun where they're teaching virtually. And I know that there's a great push to get our teachers vaccinated. And I don't, I'm not going to put you on the spot, but I'm saying that publicly, that our teachers who are in the classrooms, in my opinion, should have a priority to be vaccinated. And I will just leave that there. So Supervisor Canlon.
Thank you, Madam Chair. I completely agree with your statement there, Madam Chair. I know that there was, I think, a press release today by the administration talking about getting some more of the reserve vaccines that were being held back out to folks. I guess my one question would be, do we anticipate that's going to help in this process? I hear from what you were saying at the beginning that really we're constrained by the limited number of vaccines that we're getting. And if that's true, I think that's what I heard, but please correct me if I'm wrong. I want to make sure that Prince William County and everything that we're doing, you don't have, and when I say you, I mean the royal you of vaccine distribution, has no financial constraints. This has to be our number one priority, 1 through 5, on getting people vaccinated. Chair Wheeler's absolutely right, getting teachers vaccinated, doing everything that we can. Now, if we're held back by the number of vaccines that we get in the state, well then, I mean, we're doing everything that we can, but I want to make sure that we're looking at ways of setting up, high school for teachers to come on Saturday and Sunday and getting their vaccines, or putting these. You said that sometimes that they're able to go out to remote locations, looking at Four Seasons, Heritage Hunt, these senior living communities where we know that they go out and vote. We know that 90% of them will show up, and hopefully 90% of them can show up very easily to get vaccines. So you hear these horror stories of across the country, bureaucracy getting in the way of getting these vaccines out. And I just want to implore, if there's anything that we can do on a county level on getting these vaccines out to folks. I'm still troubled that that the governors decided to put 75 and older instead of 65 and older. And to me, that just means that we need to get these out quicker so we can hurry and get to that 1C.
Well, I'll tell you, the 75 and older are a very tenacious bunch. The first, yesterday, which was the first day it was open, we had over 5,000 sign up, and certainly the phone's ringing and all that today. To be honest, our limiting capacity is vaccinators, which the county is definitely stepping up and helping. Part of the challenge is what is some of the state requirements. If we have the vaccine, the Prince William Health District is responsible for the vaccine, gets distributed directly to the Prince William Health District, I am required to have a public health nurse, a skilled public health nurse, to oversee the vaccination process. So because we only have 4 that have been around, wait, let me finish. We have a total of 11. Most of them have been here less than a year and are not at that point. And about 6 of them are almost brand new. And so they can't fill that position. So in part, that's to increase vaccination. Part of the reason we've reached out to partners and continue to reach out to partners, if they have the vaccine directly delivered to them, then it's up to them, so to speak. But we're looking at what we can do to bolster the number of vaccinators. As I mentioned, the MRC nurses, the school nurses, have been terrific. Since they've been doing it, we can identify some leaders that probably could fill that role. Challenge will be, of course, will they be available to fill that role? So that's our biggest challenge. We've been able, the city, the county, whatever, has been very generous about offering spaces or places for us to larger than, which was a challenge initially. But having that leadership overseeing the vaccinators is going to be tough for one person to oversee 12 people. And the biggest challenge is ensuring that you don't waste vaccine. Some vials, even though they say 10, have 11, making sure they share the vials. At the end, looking for people if there's, vaccine that we don't want to waste, and that's an added challenge.
Supervisor Angry, then Supervisor Franklin.
Thank you, Madam Chair. Dr. Asher, thank you again. You'll notice I'm going to wear this mask right now all the time, and it's because while we're on this path of vaccination, our COVID numbers are seriously through the roof. And, I don't know if the number's right, but 1 in 5 Americans will more than likely contract COVID-19. And my concern with that is, while we're trying to upright this ship, I don't want the ship to sink faster than we get the vaccinations in. So really 2-part question. One is on the testing, the COVID-19 testing. I know we're still doing it, but because we're at almost a year into this and we've really kind of gotten a real good plan of how to test and get results. And I believe I'll ask you or Brian on how's the team doing that was doing all of that testing, and now we're focusing and doing a lot of vaccination. Is that team still engaged in that? And is there an opportunity for? Yes, ma'am.
Brian, do you want to?
Yes, sir. Madam Chair, Mr. Angry, the testing task force is still operating. Okay. You have been getting the notifications every week, and that's going to continue going forward. And testing is continuing to occur also in private settings. Mm-hmm. So we continue to test more than any other jurisdiction in North Virginia using our CARES Act money.
Thank you.
But the CARES Act money is going to be running out, which we'll be briefing on in a little bit.
Okay, and that's the private piece is what I was kind of getting to the point of, because we have other organizations that have really gotten into testing as well. So, I'm curious if we've reached out to them agencies, and do we need that? And I will use Neabsco District as a classic example. Nassau District is very high in positivity rates of testing. So I really want to see, and this is not a slight, this is really a passion for me, that I really want to see us get a real hard knock on testing so that we can really get people in the contact tracing mode to stay home. In case in point, I had to scare myself right before Christmas where I had to do quarantine in place because of a contact trace call came to me from an event that I was at. Okay, everything's okay, family's okay, and I do have an underlying condition in my house that I'm not willing to bring that home and go through this. But I know the vaccines are here, so I would love to get more testing and even using some outside agencies so that we can get contact tracing, so that we can really get the public to understand, stay home. And I know we got a lot going on, and people want to be out, and they want to say they got to be out to fight for their causes. I got it, but this is a very, very sensitive and delicate situation we're in right now. That if we don't do what we need to do, this ship is going to sink, and I don't want the ship to sink. And so just to the vaccination question for you on that, the 75 and older population, I know we have, like the mobile unit you said, I have a large population that can't get out of their homes. They're ambulatory. So is there a plan to, and I know this is hard because if you bring the vaccine to them, you're going to have to sit with them for a while and make sure they don't show those symptoms. And I know that's going to consume a lot of time. Is there a plan in there somewhere? Has that been looked into in a discussion of how do we get into the homes where we know these folks aren't getting out? And really the reality is because their children have moved on, and we have a lot of elderly that really live at home by themselves.
That's, as I mentioned earlier, one of the passions of the director of the Community Health Center. Apparently, they've used their mobile unit to provide, deliver food and whatnot, and that was the first thing he asked me, would they be able to do that? And certainly, of course, that would be ideal. But it's a balance. We have to be careful. We can't go to every senior living, as you mentioned, I guess it was mentioned, they can come out and vote. If they're able to come to a clinic, we need to save that specialty service for those who can't.
Supervisor Franklin and then Supervisor Vega.
Sure. Thank you, Dr. Ansher, and thank you to yourself as well as Mr. Martino for answering a lot of those questions we had coming in when the guidance was released. I do want to just have you clarify some things publicly based on some of those emails. There was a phone number listed for people to be able to call and get more information that wasn't working. Has that been fixed?
Was it the call center phone number?
I believe so.
Yeah, we had a problem with the telephone number. I believe that's been addressed, and the wait times also. Calls are being dropped, and so we've expanded the number of lines, and so we're going to be setting up in person here and then remote for many of our other employees to be redeployed, so to speak, to the call center to address those issues, especially with the folks 75 and older.
That's great, thank you. And then also, we also had a resident that asked about group homes, particularly for her son who had some disabilities. And so can you just address those individuals who are not in a nursing facility or necessarily a long-term care facility?
I'm sorry. Actually, because of her, I did some research and found out that most of the group homes in our community have signed up with CVS. And she actually knew that. I think understandably, she was concerned that they weren't able to give her a date exactly when they would be in the group homes. I believe the long-term care facilities come first, the assisted living, and then the group homes. So she was aware, but I understand her concern.
But for the public, just so they understand if they have those same questions, you just gave pretty much the schedule of which, the long-term care facility, the nursing homes, long-term care facilities, and then the group homes, right?
The long-term care or the skilled nursing facilities, then the assisted living facilities, and then the group homes.
Okay. And then lastly, I know we have the Moderna vaccine as well as Pfizer, and I know Johnson & Johnson is working on completing their vaccine. Do residents have a choice in which vaccine they receive, or is it dependent on where they go?
Because the Pfizer requires that ultra-cold freezer, it's not like Joe, doctor, nurse has that. And there was a challenge We still haven't had ours, received ours, and we ordered it and were promised it in December. We ordered it, I think, in November. That's why your Office of Emergency Management stepped up and got us a freezer that could go down, but is meant for Moderna, which requires a normal freezer temperature as well as can be stored in the refrigerator. So a lot of the hospitals, or hospital systems, should I say, do have access because of pharmacies to the ultra-cold freezer. So it made sense as not to wait to give them the Pfizer and the local health districts having the Moderna. It's also made it easier for us to bring on partners to vaccinate because, again, not many places have this ultra-cold freezer. And so being able to have a vaccine that you can use, what you use for normal vaccines, is an advantage.
But just to be clear, the type of vaccine you receive depends on where you get vaccinated.
Yes, but they're the same type of vaccine. They're mRNA vaccine.
I got you.
So,
So it wouldn't really make a difference.
No, and,
Gotcha.
and they have the same benefits, and the concern about very little concern, but there is anaphylaxis.
Sure. And my last question, I think you may have answered this with Supervisor Canlin's question, but just so that I understand, if there becomes the situation where nationally states are being encouraged to release all of the vaccines, regardless of which group you belong to, is Virginia and I guess is Prince William County prepared to do that? And that you may not be able to answer that, but I'm just curious.
No, but I would assume then if there's an abundance of vaccine, you would be able to have all healthcare providers, maybe not with the Pfizer, but with the Moderna vaccine, to be able to offer the Moderna vaccine. Look how many places offer the flu vaccine. So I think it would give more opportunities. You could have university health places offering it, et cetera.
Okay. Thank you.
Dr. Ansher, can I ask you to go 2 slides while the board is talking, because it has the contact information up.
Oh.
I want to make sure that gets out.
Whoops.
1 too far. There you go.
Supervisor Vega?
Thank you, Madam Chair. Dr. Ansher, I received an email from a constituent who pointed out that Florida has a registration plan that notifies folks when it's their turn in the queue to get the vaccine. Is Virginia going to consider this or do something similar to this?
We have that. and
Okay.
Unfortunately, it's a federal system that hasn't been very user-friendly, so we're switching to something called PrEP mod, because that's what the hospitals switched to and found it much more user-friendly. So that's why people need an email. They provide us information. We upload, a clinic opens, we upload their information into the system, and then the system notifies the individual to sign up and that they could pick an appointment in a day in a particular clinic. The challenge is you can't block off. What we would love to have done is block off certain clinics for the 75 and older. You can't do that. And in fact, everybody in the United States can see all the clinics. So if I wanted to get vaccinated in Hawaii, I could set up an appointment in Hawaii. So the system's been a challenge, but that is the way it works. And, technology can be wonderful if it works well.
So for clarification purposes, you said it was PrEP mod?
That's what we're going to be moving to.
Okay, so this is a software that will hopefully assist us in vaccine distribution and management?
No, actually,
Or just who can get tested and when?
yeah, I'm not 100% clear about vaccine management. The one that we have now can be used for vaccine. We don't distribute the vaccine. VDH central office does. We put in an order. We put in an order for our partners, and VDH distributes the vaccine. This system does allow people to make appointments.
Okay, so we all know that we have a limited number of vaccines. If you don't reach that number of folks that need to get vaccinated, let's say today, what happens to the remainder of the leftover vaccines?
We haven't experienced that.
Okay, so just for the sake of transparency, received an email that Prince William County is not reaching that number and that vaccines are being tossed because they cannot be refrozen. Is that an inaccurate statement?
There's nothing
Okay,
accurate about
great.
that.
Thank you for clarifying that. And then you also talked about vaccinators, and we're grateful for our nurses and that they're able to help out. Have you all thought about perhaps seeking out the help of paramedics, maybe paying them overtime to help assist in the process?
Yes, we have, and I don't know, Mr. Martino, do you want to speak to that?
We have been discussing this with Dr. Sullivan, the medical director, and actually, do we have an update on that? It's still pending because our EMTs operate under Dr. Sullivan's license. So if we can exploit that opportunity, we will.
Okay, and I just want to go back to the remarks that Madam Chair made in regards to our teachers. What can this board do in order to expedite the process to have all of our teachers vaccinated? How can we help expedite that process so that we can also get our kids back into the classroom?
Right now, we don't have the capacity beyond the healthcare workers and the 75 and older.
Is there anything, though, that this board, any action that this board can do to help?
Encourage our local hospitals. I mean, I don't know. I mean, I think personally, I think I absolutely agree with you. That's why I reached out to ANOVA, because I felt it would be the most expeditious way to get them done, because I don't believe that at this time we have the capacity to get both private and public school. It's not just school teachers, it's all the employees of schools, because the schools need all their employees to make them function. My understanding is second grade, first and second grade and special need kids are coming back. A lot of the school nurses have been vaccinated because they've worked in our clinics, but not the teachers yet. And I'm not sure. I felt actually pleased that INOVA was willing to do this.
Thank you. And then the last, I guess, comment that I want to make is in regards to an implementation plan. We have a lot of folks, at least I do, I don't know the rest of my colleagues, if they have folks, in the 64, 74-year-old age bracket who are asking where, when, how, when is my turn? And so I know that we've been having some issues in terms of how folks can access information. If we can get a little clarification, I guess, so that we can let our constituents know how they can do that. And if we can just, I guess, work together to establish a more clearer path forward, because, I am very appreciative of all of the work that has been done so far, but there are some areas that we can work
absolutely
harder in order to tighten it up.
Absolutely.
Thank you, Dr. Ansher.
I think one way it's being addressed, there's a JIC that has the 3 jurisdictions and public health working together to develop information. We certainly want one message. Additionally, I think it's been a bit of a challenge. What is the right thing to do? And we found that with the healthcare workers. We sent out a press release, we blast faxed, and we're not allowed to get all the names of all the licensed providers. We did the best we could, but I do agree we are working on ensuring that we're more transparent to our elected figures as well as our population, and I think that's the development of the JIC hopefully will do that.
Madam Chair, I do have one final question. Is there a way for folks without an email to get access to the queue? Because not everybody has an email, not everyone has access to internet.
Yes, there is, and it's the terrible thing about it is they'll end up having to stay at the clinic a long time, which I know will make some people understandably fearful, because they'll have to spend time registering. They'll have to spend time reading the information on the emergency use authorization. If they call us, and we can call us in advance and don't just walk in, we can certainly send that information to them in advance. But if they don't, if they just walk in, we won't have that benefit. Additionally, then they also have to go through a medical screening. And then, of course, they'll be vaccinated and have to wait either 15 or 30 minutes, depending on their health history. So there is a way. It's not ideal, and we're hoping that PrepMod has a better way to do it. This is the system we were given.
Thank you. And, I know it's an ever-changing situation. Every day something changes, or there are always maybe opportunities that we can work on. And so I would ask that when we come back next week, in a week, that someone, and not necessarily Dr. Ansher, because I know that she is very busy, maybe Mr. Meisner or even Mr. Martino, give us a brief update on anything might have changed that makes this situation a little more palatable.
We plan to do that, as we have been doing
That'd be
throughout this
great.
thing. We'll keep you posted.
Yes, okay. Thank you very much for, Supervisor Lawson.
Thank you.
Yeah.
Dr. Ansher, how soon do you anticipate this new system that you're referring to that you hope is more efficient for registering?
We were told that Monday we'll be able to start training.
This coming Monday?
Yes, ma'am. Although it's, that's what they said, obviously not probably Tuesday because of the
Okay.
holiday.
So when that new system is in place, can you send us some pertinent information that we can push that out to our constituents as a resource?
Certainly.
Thank you.
Obviously, there is a learning curve, but we have our hospital partners that are using it that can provide us some lessons learned.
And I do see one more question from Supervisor Bodie.
Thank you, Madam Chair. Thank you, Dr. Ansher, as always. I'll keep it very brief since we've gone around a little bit. I want to touch up a little bit upon what Supervisor Vega was asking about in terms of outreach to folks who, they don't have access to internet. Because one of the prime ways I've seen, especially 75 and older folks, be able to sign up is through a Google form. And I also wanted to highlight that for you as well, because some folks, they just see a Google form and they think it's sketchy or shady because they don't know where it's coming from. So I just wanted to flag that for you. But I guess where I'm going with this is that my office, I'm sure a lot of other offices have gotten a lot of questions about how people can actually start getting appointments, even if it's farther enough out so they can start to plan, quarantine themselves, get their families ready if they don't have access to good transportation, which is a whole nother thing that we have to talk about, how people can start looking at what this timeline looks like. Because we know that we're especially with you in your seat, this stuff is changing literally every day, if not hour to hour. But for us to give our constituents some peace of mind, it would help if there's more information that we can give them, that's stable, that's consistent, and more importantly, that we can get out to communities that aren't always going to see Google Forms or websites where you have links buried and things like that. So whatever you can do to help us out with that would be.
And we appreciate the newsletters that the board members put out. That's helpful. We are working with the Area Agency on Aging to do a better a rollout additionally of providing information for actually the 65 and older, not just the 75 and older. And they're actually going to help us in the clinics with the people 75 years and older. But I don't disagree. That was a big concern of mine. I'm pleasantly surprised. A lot of them are more tech savvy than I am. But it's a problem, and a problem also with the system, because without an email, they can't receive an appointment. I'll let you know that our appointments are open through April 30th, where we're at George Mason University. So should they get into the system, they have a large range of where they can schedule an appointment, now that we have a stable site that's possible.
And just a follow-up to that, once the DMU site is completely up and fully operational, how many vaccines is that going to be approximately?
We're guesstimating we'll be able to do 540 a day.
Okay, 140 a day. And are there any other stable locations you guys are looking at to set up?
Not necessarily just us. As I mentioned, Safeway will be 3 times a week, all day on the eastern end. Remind me the name of the park?
Vets Park
Thank you.
in the gym there.
The Community Health Center, MAP Clinic will be vaccinating every day. We have a pharmacist in Gainesville that we help provide vaccine because we know the population that's around his pharmacy. He feels confident he can advertise to make sure people in his community are aware. He's starting small, of course, to get used to the process, but that's another partner. Micron will be coming on. I'm helping them get set up so they can get vaccine distributed to them. So we're trying not to just depend on the health district because it's not going to work.
Right. And just last two. Sorry, Supervisor Bailey, I know you. Last two points. And I can't highlight this enough. A number of my colleagues already talked about this, but we heard recently that a custodian in one of the schools contracted COVID, and there's a tragic situation there. And I actually have friends who are Prince William County Schools teachers that live in Fairfax, and they've been able to go to Fairfax with their vaccines before us. So obviously, no fault of your own or anything like that, but I just want to highlight and underline the fact that we are behind right now other localities, and it's causing a lot of uncertainty with the populace, and especially our special ed teachers who have to be in close quarters with children that some of them are unable physically to keep good hygiene, things like that. We have other folks that are representing frontline communities that are the most vulnerable to this virus that, frankly, if they lived across the border in another county, would already be in line and have an appointment. So I just can't highlight enough how especially our teachers that are already in buildings and are going to be in buildings the next couple weeks, they need to be somewhere prioritized. And just the last thing is, we know that we have one of the highest positivity rates in the Northern Virginia region. So what is our strategy right now to look at what other localities are doing that have lower ones to somehow bridge that, well, not bridge the gap, but what are they doing differently that we're not doing, I guess is my question.
Behavior.
Okay.
A lot of it's behavior. No masks. Well, it's more than no masks. It's small gatherings,
Sure.
et cetera. Traveling. We saw a lot of the student athletes travel and then come back positive. The schools have actually done pretty well. It's the employees that have out in the community who have been positive. We haven't had very many outbreaks among students. Additionally, the athletics where there's close contact has been a challenge. A lot of them do the right thing at work, but don't necessarily do the right thing when they're outside of work. And they've been educated over and over and over again. It's behavior.
Sure.
And people are tired. And I'm not saying it's the right thing. Even getting a vaccine doesn't mean you stop social distancing and don't wear your mask and wash your hands, et cetera. It's not the panacea. It's a tool right now.
So I appreciate that. Thank you, Dr. Ansher.
No? Okay. Thank you very much,
You're welcome.
Dr. Asher, for spending so much time with us.